Hello, I'm Dr. Sambo Puje Fiakpo, and welcome to the African Community Forum. Did you know that May was Mental Health Awareness Month and July is Minority Mental Health Month? Nearly 47 million adults in the United States face the reality of managing a mental illness every day. On today's show, we explore the topic of mental health and resources available in the area. Joining me for a discussion today is Dr. Belina Shaw, Medical Director of Mental Health Services at Prince George's County Health Department, and Karen Howard, Advocacy Manager at Mental Health America. Welcome to the show.
Thank you.
So to start things off, what is mental health and what are some of the various ways that you see mental illness present itself?
So I'll let you start.
Sure. So one of my favorite definitions for mental health is from the World Health Organization. And I'm going to read it. It says that mental health is defined as a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. And I love that definition. I love it because it's individualized and it really focuses on what that specific person wants to do with their life, and that it's strength-based. So it's focused on what they're doing and not a deficit. When we think of mental health or we think of mental illness, we often think of what's wrong and a deficit. So I love that it's a strength-based definition. And I also like that it focuses on the community. So it's how are you being productive in the community and however that individual defines it. And that's why I love that definition, that it's really a holistic definition, thinking about that person in their role in society.
I would agree. Mental health is a combination of psychosocial, emotional well-being, and occurs along a spectrum with mental illness. And so I think some of the mental illnesses that we see present themselves are anxiety, depression, bipolar disorder. There are hundreds and thousands of other mental illness or mental health conditions in the DSM-5, and we will probably not be able to cover all of them here, but those are just a couple of the very prevalent ones that may become issues or problematic for people, and that there may be help for when someone wants to seek treatment.
Okay, so I heard you mention anxiety, but what are some of the common mental illnesses that you see in the community?
Sure. Well, depression is the most common cause of disability worldwide, according to the World Health Organization. So depression can present often as a sadness or not really enjoying life, and also in children, adolescents, or just younger people, it can also present in as an irritable mood. So that's extremely common, and just people sometimes aren't as productive as they would like to be, or they're not maximizing their relationships or having relationship problems. So that's very common. And anxiety that you mentioned as well is the most common mental health condition in the United States. And that can be a broad spectrum between worrying a lot, having a panic attacks where you're feeling like you're having a heart attack, or a respiratory, like a breathing problem, to also, just for some people, it could also feel like you're having symptoms of headaches, stomach aches, all these unexplained medical conditions that the doctor really can't find an answer to. And so we as doctors, if we start finding these things that we don't have an explanation for, then we start to think maybe it could be anxiety. And especially in children, it can present that way too.
Some of the other symptoms that may come up that a person may not have a label for are sadness, hopelessness, sleeplessness, fear, or phobia, or something that they may not be able to put their finger on but have some fear about. And there's also dread and periods of hypo or hyperactivity where you may have a lot more energy than normal to carry out your daily activities, or you may feel drained and unmotivated to be able to carry out activities. And so some of those symptoms may be signs of a mental illness.
Okay. Can you both talk about the stigma around mental health and what might be some causes behind that stigma?
Sure. I think there are two types of stigmas. There's the self-stigma that one may feel about their own abilities or inabilities, and then there's also stigma that other people may place on them. And I think stigma is an attitude or type of special negative treatment, I guess, given to the idea of having a mental illness. And it forces people to kind of stay behind the shadows and be a little quieter about what they may be going through. It may make someone less likely to reach out and ask for help if they may need assistance during a time. And so stigma is, I think, becoming less apparent, but it's still very prevalent.
Yeah, and I think there are two main causes that I like to think about with stigma. Is I think there's one piece is ignorance, so people just not knowing about mental health conditions, and that's why we're so glad that you've had us here to do this show so that we can just talk about that. And then also people are ignorant about what causes mental health conditions and the treatments that they don't know that it's treatable just like any other condition. And then a lot of times people have fear of people with mental health conditions and fear of the conditions. And we have to remember that most people who have a serious mental health condition aren't violent or dangerous. They're actually at a greater risk of being harmed. So, especially if they're not being treated. So, I think that ignorance and fear are the two main causes. And even with that fear and ignorance that can come from the outside and creates that self-stigma, there's literature that shows that people who have self-stigma actually do worse with their mental health outcomes, even if they have the exact same treatment. That self-stigma can make them feel like they're not doing as well as somebody else who doesn't have that self-stigma. Mm-hmm. So I think it's an internal piece. That ignorance and fear can also be a fear of the future that can impact someone's actual life outcomes.
And I think that it's worth noting, since violence was mentioned, that not only are people with a mental health condition more likely to be victim of violence, but the intersection really of violence carried out is through suicide. And that's the highest rate of violence in people with mental illness. We're seeing youth suicides rates rise very quickly over the last 5 to 10 years. And there are probably many contributing factors, but I did think it was worth noting that suicide is the point of crisis that we are trying to prevent and work against.
Yeah. Thank you, ladies, so much. Those are some really, really poignant points that you all have to say, and stay tuned. We'll be right back.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere, and just growing up the way I grew up, and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
Hey, you.
Yeah, you. Getting that college education, what are you gonna do? Graduate and take some office job? Be like everybody else?
Or will you dare do something different?
Like, be a teacher. You could be my teacher. You got the skills.
The smarts?
Yes, you. You could be the teacher I never forget.
That'd be cool.
Does that corporate job even have recess? What are you gonna make of yourself?
What are you gonna make of me?
Welcome back. As we discuss mental health, it's difficult not to think about the role of technology and social media in our mental wellness. So in this day of constant digital stimulation, does that take away from or add to mental health issues? Either one of you can go first.
Sure. Well, I mean, the data is mixed on this topic. So as far as the use, especially of social media, that there has been some data showing that people who use social media more have a higher risk of depression, and if they stop using it, that their depression rates go down. So there is some risk. But then if there are populations that we'd say marginalized, or populations that people that don't really feel like they fit into some of the live social interactions, that those populations sometimes can feel a little bit more connected. So the data really is mixed on that. And the other piece to really think about as well is cyberbullying. When we were in school, you go to school, you come home, and you're away from the school environment. Now with digital media, that you're connected, children and adolescents are connected consistently to their peers, and that bullying can go on, and that actually creates a risk for suicide, as we were talking before, and that can create mental health conditions as well.
I would agree with Dr. Bellina. There is association, and not necessarily causal, but there is some correlation between use of social media and mental health conditions. And I think there's a specific example in college campuses where freshmen who use social media as a tool to keep in touch with their high school students were actually, or their high school friends were not as engaged on the college campus community, and thus felt more isolated and did not feel the social connection that was happening that maybe seniors were feeling, because seniors at the college level are using the social media tools to plan events, figure out where to go next, and keep in touch with each other prior to some type of in-person engagement. So I think it's really important to note that social isolation is becoming a rising issue for youth as well as for older adults, and building community, networking, and keeping in touch with family, friends, or other support systems are really important and must balance out our social media use.
And along those lines too, there are some benefits of media, including the use of apps or use of technology for coping skills. So when I'm in a session and someone's having some problems with anxiety, then maybe I'll find for them a relaxation or meditation video on YouTube. And there's some apps that can be useful in aiding in different types of therapy. The FDA actually has approved one of these apps, and being a helper for therapists for the home environment. So between coping skills and some of these apps, there are some benefits to the use of media that could be helpful in treatment for treatment purposes too.
Okay, so it sounded like you all mentioned social support, also coping skills. Are there any other things that individuals can do to prevent experiencing mental illness?
So I think that mental health conditions are partially biological and partially preventable, just like diabetes or other chronic conditions. And so self-care is really important. And we've seen that in youth. There was a major Kaiser study done that found youth with adverse childhood experiences, or ACEs, when they had a higher number of ACEs, which include neglect, abuse, or other forms of trauma, that those people would have were more likely to have depression or other mental health conditions and chronic conditions in adulthood. So one way to address prevention of mental illness is limiting trauma in childhood.
And along those lines, that same study showed the mental health conditions in the future, but then also ongoing medical conditions, including cancer, heart disease. A lot of our main killers in our country, they were associated with having poorer outcomes or higher risks with this early childhood trauma. So these underlying themes of that stress management, as well as a healthy diet, healthy lifestyle, and really making sure that we're protecting ourselves and our children from possible dangerous situations are important. And early intervention really is the key, that almost anyone has had something happen to them. Everyone at some point will have something in their life that could happen to them that could bring out a mental health condition based on their own biology. And so if anyone's finding that those symptoms are a little bit beyond what they could bear, basically that definition from the World Health Organization, then early intervention is really the main key to prevention.
Okay, so I heard you all mention self-care and maybe some other things that individuals can do to prevent mental illness. And I know we're going to talk a little bit more in detail about specific resources, but just in general, what are some daily things individuals can do to address their mental health, improve their mental health?
So along those lines with the social media, I think that sometimes decreasing tech time can be good, just having some specific time to make sure that you're checking out of the social world, the phone, etc., and checking back into real life. And making sure that you're getting lots of sleep, especially with the phones at night, if you're sleeping with a digital device, that waking up and seeing that light turns off our body's natural mechanisms for sleep. So sleeping well, getting good hydration, exercise, good diet, those are all very important. But I think that sleep, especially in young people, is extremely important.
Sure, I would agree with those recommendations.
Okay, wonderful. Are there any other strategies that individuals can take on? I heard sleep, nutrition, kind of reducing some tech time. Any other self-care strategies?
Sure, so I have written down here and wanted to say that Mental Health America has online screening tools. So if you schedule some time to be online, you can check in with yourself and take a screen for anxiety, depression, bipolar, psychosis, and then just kind of read up on what some of those conditions look like, feel like, what they mean, and even if you're not in a place where you feel like you need some help, it's good just to check in with yourself, I think, and know. And if you're not using our online screening tool, then maybe keeping a journal and writing down thoughts or emotions that you're having throughout the day or on a weekly basis. I think it's really good to have build your interpersonal relationship.
Along those lines of writing things down, one really good technique as well is at the end of the day, every day, writing down 5 positive things about what happened in the day. And even in the very worst day, that 5 good things that happened, and getting into a routine with that, and that has shown to have a mood boosting effect. No matter how bad the day is, finding 5 positive things can always get us in the mindset of closing out the day in a positive way and getting us started for the next day in a positive way as well.
Wonderful. Those are really, really great tips, ladies. Thank you for sharing that. Stay tuned and we'll be right back.
I love taking care of my mom. It wasn't easy at first. She learned how to better communicate her needs.
And you learned how to not ignore yours.
I discovered how to make healthier meals.
And I discovered how much I enjoyed them.
Becoming a caregiver is a learning experience for everyone. Find articles, tips, and tools from experts and others who have been in your place. The Caregiving Resource Center at aarp.org/caregiving.
When I was 6, I had one thing on my mind. When I was 6, my days were spent playing basketball every chance I could. When I was 6, my dream was to make it to the NBA. When I was 6, my mom had a stroke.
I'm Paul George, and I want you to learn the signs of a stroke fast. F-A-S-T.
F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911. Because the sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery.
Protect the ones you love.
Spot a stroke, F-A-S-T, fast.
Welcome back. Karen, can you tell me more about Mental Health America?
Mental Health America is the oldest consumer advocacy organization, begun in 1909, and we come from the perspective of a person with lived experience with a mental health condition. We were part of we're the oldest mental health advocacy organization, and we're a part of the recovery movement in the 50s and 60s, where many hospitals were closed down because of human rights abuses, and many people were really adamant that treatment needed to be found in the community closer to home. So since 1909, we've been advocating on the ground, at the state and federal levels, and we've built several programs that we also carry out and administer. And our philosophy is called our Before Stage 4 philosophy. And it's based on the idea that there should be prevention for everyone of mental illness. There should be integrated supports and services in the community for people who need them. There should be early identification of mental illness in childhood or early adulthood, because most mental illnesses present themselves by age 24. And that there should be recovery as the goal. So we know that people can recover and live full lives after any type of mental health crisis or diagnosis or other manifestation.
Okay, great. Well, what are some of the programs that you provide to the community?
Sure. Our largest program is an online screening program. It's mhascreening.org. And people can, or we have screenings and then supports for people once they take a screen. And there are 9 different online screens. People can choose to identify. It's all anonymous and confidential. And we really use the data from the screens in aggregate to talk to stakeholders in the community and elected officials to make a point that people are looking for information, resources, and access to mental health services. That program gives information generally about a mental health condition specific to which one you screened for. And then there also is a peer community online that you can sign up to talk to other people that may be having some of the similar symptoms or experiences as the individual who screens. And then there's support based on the zip code. If you give your zip code, you can find services in your area, either online or in person. Okay. That's our screening and screening to supports. We also have a regional policy council, which holds policy meetings across the nation with state stakeholders, where we talk about and then build advocacy with legislators about parity, insurance, coverage and access issues, including cultural and linguistically competent services in health plans, and network adequacy, and ensuring there are enough providers for people to go and see someone that looks like them and be able to open up and share in a therapy session or other type of service environment. We also have a big toolkit that we roll out, providing resources and information for people. And we do that 3 times yearly at least. We do it for May as Mental Health Month, which we started in the 50s. We do it for July as Minority Mental Health Month. And we do it for back to school in August, so that students, teachers, and parents all have resources that might be useful in getting ready for the new school year.
Wow, that's a lot of programs and resources that you have available. I'm interested in knowing whether there are any trends in the minority and immigrant communities that you may see when it comes to mental health, and what are some of the things that your organization is doing to assist around that?
So we certainly know that there are trends in our screening data. For instance, Black Americans are most likely to say that they are willing to seek professional treatment or help after taking a screen. We also have worked with members of Congress to get research done in specific areas about access issues and services, and how young Latino people are more likely to receive and have better outcomes in treatment when it's provided in schools. So we know that school is really a target area for services for students. And we know that there is a lack of representation when it comes to providers, because providers oftentimes do not reflect people of color, at least not based on the ratio of general population to providers. And so there are loan repayment programs and other incentives that are being created to help draw people of color who are providers into areas where they would be served best.
Wonderful. Thank you so much for sharing, Karen. Hi, Dr. Shaw. Hello. Can you talk about the various resources in your office to assist the community with mental health?
Sure. So within the health department and broadly, we help to coordinate and make sure that there's a broad array of providers and services. And so the Prince George's County Health Department has a branch that oversees the public mental health system, but we also want to make sure that people are getting services wherever they can. So one thing that we also strongly advocate and support is people seeking help from their primary care doctors if they think that their symptoms are mild or they're unsure, and that's a comfortable and safe space a lot of times, and they often do screens as well to help to get people connected right away. And then also we also have therapy through the local providers that are in the community. We also have a clinic at the health department as well. And one of our major initiatives is called Step Forward, and that is an anti-stigma campaign focused on children and families. And you can call 211 throughout the state and get information about a provider that might be helpful. If there's someone in imminent danger, then you can call 911 if someone's very unsafe, or go to a hospital as well. And then also children and adolescents, or anyone, can text. The number is 741-741, and you text MD to that number, and then they will be able to reach out and give some support that way too. So we oversee lots of programs in that way. And I also wanted to highlight too that substance use disorder is, I kind of call it sometimes two sides of the same coin. That for some people, their coping skill is using alcohol or drugs. And in this climate where we know that opiates is getting a lot of national press, still alcohol is the #1 killer of people as far as drug and alcohol overdoses or related conditions in this country. And so people may cope with those types of strategies, or they could have mental health conditions from the effects of substance use, and you can access services for substance use disorder in that same way as well. And I think there's also a lot of stigma around substance use disorder that's sometimes greater than mental health, so I wanted to highlight that too.
Sure. Well, thank you, Dr. Shaw. It sounds like 211 is the best way to access and get in touch for those services. Yes. So thank you so much for sharing those resources. Thanks to all our panelists, and thank you for watching. Remember, the more conversations we have on mental health, the less of a stigma it becomes in the community. It's okay to not be okay. Please be sure to access the resources discussed during the show if you or anyone you know may be struggling with a mental health or emotional issue. Again, I am Dr. Sambo Pujay Fiakpo. Take care and stay healthy.